Hello there, my name is Dr. Bhavesh Kumar. I'm a consultant in sport and exercise medicine, and I'm the program lead for the BSc in Sport and Exercise Medical Sciences. Welcome to our overview of the program, and what we'd like to share with you for the next 20 minutes is an overview of the program, what it entails, what you learn, what it's about, the opportunities that we intend our students to benefit from, and what sort of careers they might embark upon after completing the program. And we'll also give an overview of what sort of teaching methods that we use, the skills that you'll obtain, and the research opportunity projects that you'll have during the course of the 3 years. Let me start by introducing you to our team. So we have a fantastic team of core lecturers and tutors on the program, and we're ably supported by lots of experts in the field in the topics that you'll be learning about. And these experts come from not just UCL, but around the country and around the world as well, because UCL is an attractive proposition for lecturers and experts in their field to come and talk at. So I've introduced myself on the left there, Dr. Bhavesh Kumar. We'll have my teaching fellow colleagues joining us. Dr. Flaminia Ronca will give an overview of the teaching and research opportunities. Her background is in sports science. Dr. Dan Coughlin is a strength and conditioning coach and a physiotherapist by background. And Dr. Amelia Alifrangis is a general practitioner with a special interest in sport and exercise medicine. And as you can see from our diverse backgrounds, we're all interrelated and work together as a multidisciplinary team, both in our clinical practice, work with athletes, and as program tutors for this course. So some of the places that we work at are listed here, and the reason we show this, for example, in elite sport, in the military perhaps, in private practice within the NHS, and at big sporting events such as the Olympics and world tournaments that come every 4 years, is because these are some of the opportunities that you might get to experience further insight into during the course of the program, potentially even undertake some research within these fields, and sometimes these can lead on to career opportunities themselves. So what is SEMS? Now, SEMS is a unique program. It was the first program to run in this country that essentially tries to build upon the traditional courses of sport and exercise sciences or sports sciences that are run across the country. But this course is different. What we're primarily trying to add here is robust clinical science and the medical sciences, so you have a fundamental background in how the human body works in health and disease, and then how that helps us perform when we optimize all the parameters in elite sport and exercise. So it's absolutely a continuum from the bare basics of the human body, from the molecular level to the cellular level to tissue and organ and systemic function, and then optimizing those to perform. And that's not just for sport, but also for patients within clinical practice, those that have chronic diseases. We're trying to essentially improve their health and well-being by helping them to become more physically active, make them more aware of their lifestyle behaviors that may be deleterious and predisposing them at risk of having medical complications, and trying to help them through physical activity, sport, and potentially exercise for those that wish to. So we're dealing with a whole breadth of people at different levels of physical activity and sport, the problems they face, improving their health and well-being, and optimizing performance. So that's the ethos of our program, to make you comfortable in dealing with patients, sportsmen alike. With any undergraduate program, we always offer a robust scientific research package, and that enables you to become familiar with the latest evidence, how to critically appraise that evidence, to understand what it means, and to potentially implement that in your practice. And you will get first-hand experience of some of these projects that we'll talk about later in this video. So Just to give you an overview of the modules, now the different colour codes of the blocks that you'll see just refer to the years of the programme that they run in, but essentially you'll start off in the first year with a fundamental overview of the body in health and disease. We'll build up into that how the cardiovascular and respiratory system function again in health and in disease. Similarly with the gut, the digestive system and how it processes food, nutrition, medications, drugs and so on, how the kidneys work and what can go wrong in the kidneys and the urogenital system, how infection and inflammation works in the body and how that serves to help protect us from environmental factors. The nervous system is equally important as the musculoskeletal system, which we'll cover in year 2, and the fundamental basis of disease, the pharmacology. All these modules will serve to help you understand how we can help improve health in a general population level, on a patient, on an individual level. As the years 2 and then 3 kick in, we focus more on the sport and exercise elements of the course, starting with how the human body works and moves, the locomotion system, for example, the anatomy behind all of that, and how imaging can help us understand the body further, again in health and disease. Integrating into that is the sport and exercise physiology, so how we can optimize performance through aerobic conditioning, through strength and conditioning, through additional nutrition, the optimizing nutrition and metabolism, and how we can implement that within a sports environment as well, looking at micronutrients and training methods that we can help not just athletes but also patients alike. And that's where the exercise medicine modules tie in. So we're using similar principles as to what we apply in elite sport ourselves to the patient population. So there's a balance between learning and implementing what we get from our NHS settings and how we implement the best practice of that within our elite sports settings, and vice versa. Our learning and research from elite health and performance can also help our patients as well. So there is a really smooth link between the two and how we can help optimize the health health and performance of these people. Behavior change is a key element because that's often a big barrier, and you'll learn techniques as to how to help implement good healthy behaviors and to instill that behavior change effectively, because that's a large challenge in improving public health of the nation. What can go wrong if people have injuries during sport, exercise and physical activity? So, they may sustain injuries, and you'll learn how to assess them and how to formulate management plans and work in an interdisciplinary team to help improve outcomes after injury and help them rehabilitate. And so you might have an active role in helping that rehabilitation, exercise prescription, strength and conditioning to help people get back to function, whether that be work, whether that be caring for other people, or whether that be exercising potentially on an elite level as well. In terms of the research modules and the scientific skills that you'll learn, data interpretation and evaluation of science is critical. So learning how to read literature, search for literature, understand it, interpret it, critically appraise it. That's very, very important and a transferable skill in whatever avenue of career you choose later down the line. Medical statistics, so that's learning how to use software packages, applying the appropriate statistics in the context of the research that you'll do yourself in an area of interest. And that research project will start in year 2, and that will become more of a feature as you go into your final year, where you produce your own dissertation and present that with scientific means, whether that's online, through presentations, posters, and so on. There's also some optional modules, and these are just a few of the couple of the examples that we have, such as health economics, introduction to clinical trials, but there's many others that you may choose, and sometimes they may not be related exactly to this program, but we do offer an element of choice so that you may elaborate on your particular interest that strikes you at UCL, and that can be across UCL. So that's quite a nice thing that we've added. In terms of the career options, let me just give you a little brief overview. We can't go into all the careers that you might choose to go into, because fundamentally this is a broad degree that you can gain lots of transferable skills in and shape your careers into the areas that you are particularly interested in doing. So by having that, you'll have opportunities in lots of different fields, and I would argue more than traditional sports science degrees would offer, where typically and traditionally people may choose to try and work in elite sport, potentially sport and exercise science or physiology, in research and so on. So those opportunities will be open to our students for sure, but we also want to give them the skills to be confident and able to apply for jobs and work in clinical population. So that's where the exercise medicine really is a fundamental focus of our program, because we are also interested in improving the health of patients and of at the population level as well. So that's exercise prescription, facilitation and screening for people with diverse diseases such as cancers, heart disease, strokes, respiratory diseases and so on, in which we know there's plenty of evidence for how physical activity and exercise can not only help prevent these conditions, but to improve their quality of life, to reduce risk of remission or having future diseases and events like heart attacks and strokes with careful exercise prescription. So that's a key focus of our program. You may wish to work on a more global level or public health level, either nationally or wider, and where you can implement policies and implement change to a larger population through evidence-based practices and programs, rather than working in small groups with patients in a patient-facing role or an individual level, as you might do in the community, for example. So all of those options are open. You may also choose to work in academia, such as in teaching and research, such as I myself and my colleagues do, or you may wish to go into allied industries. By that we mean, for example, pharmacology, nutrition, drug discovery and development, in laboratories, if that's what you're interested in. So again, you've got the science and the medicine background to be able to offer your skills in that field. And some of our students will go on to decide, actually, I want to take this into a second degree. So some people will choose to do a master's degree in something allied, a PhD perhaps, or undertake a vocational degree, by which we mean something that trains you to be a clinical professional, such as a doctor or a physiotherapist, for example. And by undertaking a 3-year undergraduate program like this, you would be eligible to do a fast track or a graduate program, which is usually at least 1 year less of a full initial undergraduate, compared to a full initial undergraduate degree program. So this type of degree can be of real benefit and help you decide more in a more informed manner as to what you would like to do in your future career.
So what will you be learning throughout the course? You will learn how to work independently in a lab. What's great about UCL and the ISCH is that we work in very small groups in the lab. So you actually get to play with the equipment and learn how to use it independently, so that by the end of the degree, you will be able to run your own research project without having to be supervised by someone else. And then when you finish your degree and become a professional, you will already be confident with using high-end equipment on how to test athletes and patients. You will, of course, learn how to assess injuries, as Bav has mentioned. So here you have a nice picture of Bav here on the pitch side. And that is actually a colleague of mine fixing my foot, because I got injured while we were at the Institute. So we turned that into a lesson. So that's one of the great bits about working at the ISCH. You will learn some first aid skills and how to put them into practice. You will know how to design a strength and conditioning program to optimize performance for athletes or for the general population. But you'll also learn how to prescribe exercise for patients, for clinical populations, for the prevention and management of chronic disease. You will know how to test performance in athletes, And these are some examples of type of equipment that we have at the ISCH. This is a treadmill, and we're doing a VO2 max test here on an elite athlete, and this is called a dynamometer, and it measures maximal strength, and it is also used by physiotherapists to do rehabilitation. So there's lots of very exciting equipment you'll get to put your hands on. You will also learn how to use the same skills to test patients instead. So how can you help improve the outcome of a patient by using exercise as a form of testing? You will, of course, know how to conduct your own scientific research, and these are some pictures of us and our students in the lab being tested in all sorts of strength and conditioning, VO2 max and endurance testing, and some cognitive and brain imaging testing while exercising as well. And last but not least, critical thinking. You will know how to take a study that's been done by a researcher and how to pull it apart. Is the research sound? Is it applicable? Is it important? And did they do the right things? So you will be able to take a study and be able to evaluate it and solve problems through research. How will you learn all of these things? There is, of course, the big lecture rooms that we've always dreamed of. So that is one big part of university. However, interactive learning in small groups is also going to be a big part of how you learn at UCL. This allows us to follow you and allow you to work interactively in groups. And these are some of our students working together on some projects. You will work collaboratively with your colleagues. So you will be testing each other in the lab. You will be able to have a go at the equipment, and you will be giving each other feedback. You will learn how to put together a scientific poster, which will allow you to then bring it to conferences if you wish to do so in the future. And the types of assessments that we do are a lot more than just essays and presentations. You will be doing YouTube videos and blogs that you can then put on the internet if you want. And of course, you will have access to high-profile events and conferences. UCL runs conferences, the ISCH does, and we also will encourage you to take part in national and international conferences once you get into your second and third year and start to produce your own research that you can take to these conferences. So this brings us to the connected curriculum, which is a very important part of UCL. And essentially, it says that we want students to be at the same level of researchers. We want you to be able to interact with professionals, with professors, experts in the field, and we want you to be able to speak to them, learn from them, but also work with them. So a lot of our students do work on research projects that are of very high profile and end up publishing alongside very renowned professors, and we'll tell you a little bit about that in just a few moments. And that brings us to part 4 of this presentation, student research. So I'm going to tell you about a project that started about a year ago, and it was run purely by students alongside professors. The project was called Op Chiron, and it was done in collaboration with the Metropolitan Police and with law enforcement workers across London and the UK. So this is the very first meeting we had, and as you can see, you've got students of all ages across different faculties, and they're sitting alongside leadership from the Metropolitan Police and professors from UCL. We made t-shirts because, of course, making t-shirts makes everything more fun. So this is part of our team. It was just before our first testing day in the lab. So to give you a brief overview of the study, we had a strength and conditioning component. So we looked at the strength and the performance of these police officers and law enforcement workers. We looked at their injury rates and their health and their cardiovascular physiology. We did an activity analysis, so we looked at the levels of activity that they had throughout the day. We did a sleep analysis with some wearable devices. We had a brain imaging component, and we looked at their mental health. And finally, we assessed their nutrition and their oral health. First thing you do when you put together a research project is, of course, you practice. So these are the students practicing on each other before we get our actual guinea pigs into the lab. So they got to test themselves on the treadmill and some strength tests, and got to look at their own brain imaging and cognitive tests as well. So here's what we did. First, we did an activity analysis and a sleep analysis. We got our participants to wear this little device. It's called an accelerometer, and it measures your movement throughout the day and the night. They wore it for a week, and this is what we get. So we had a couple of students looking at levels of activity throughout the day and throughout the night, as well as changes in their heart rates. Then we did some cognitive tests on a computer screen while we performed some brain imaging with a very new piece of technology that's being developed at UCL called an FNIRS. This measures hemodynamics in the brain. In other words, it looks at the blood flow in different parts of the brain. And the reason why that's important is because when we exercise, we also influence how much blood goes to the brain and how much blood goes to different parts of the brain. So we wanted to know, how does exercise influence our cognitive function and our brain health? Then we did some health screening. So we did some blood tests on our participants, and we also measured their body composition in the lab. And it gives us a nice little report that tells us their muscle mass, their fat mass, and how they compare to the general population. We did some strength tests. As you can see, this particular participant was so tall that we had to remove part of the ceiling. Otherwise, we feared he was going to bash into it. Then we did a hand grip, so we measured how strong their hands are. We did some push-ups, and we did some inverted rows. So we're doing some strength tests to look a bit on the entire body. Then we did what's called a VO2 max test. So you ask your participant to run on a treadmill as the treadmill goes steeper and steeper and faster until they can't go anymore. And this is one of our participants almost completing the test. He was hitting a very, very high level on the test, and he's wearing a mask, as you can see, and the mask is measuring gas analysis, so how much oxygen his body can use during exercise, and that is an excellent measure of cardiovascular fitness. Finally, after we wore them out completely in all of these exercise tests, we got them back into the clinic room doing the cognitive tests on the computer again, measuring their brain activity. So we got to see, what does the brain look like, and what is the cognitive performance of these participants before and after maximal exercise. So very briefly, here is what we found so far. So one of our engineering students used machine learning to create an algorithm that predicts when we are sleeping based on our heart rate. So she will now be able to develop and sell an app that she created that will measure whether you're sleeping or not based on your heart rate. And that gives us a lot of interesting data to work with. And what we learned from that is that actually being fit doesn't make you feel any less tired if you don't sleep. However, if you are sleep deprived or if you do shift work, being physically fit will protect your cognitive function. So even though you do feel tired, actually being fit protects your brain a little bit. So you do perform a little bit better than your colleagues who are maybe less fit than you and just as sleep deprived. From the brain imaging, we learned that being fit makes our brains faster, sharper, and more able to control our impulses. And this is very, very important for our overall health and performance. So being fit makes us, in a sense, a little bit smarter as well. We learned that shift work is unfortunately very detrimental to both physical and mental health. But we also learned that higher strength levels protect against musculoskeletal injuries and pain levels. So even though shift works makes you more prone to becoming injured, if you're stronger, you will protect yourself against that a little bit. And it'll be a little bit quicker as well to recover from an injury if you have nice strong muscles. We found that a higher oxygen carrying capacity, so a higher VO2 max, correlates with better mental health and physical health. So we all know that a fit person is normally a healthy person as well. And finally, this is probably the most exciting picture of all of them. A single bout of very intense exercise actually makes our brains faster, more accurate, and it improves our memory. So although we might think that if we go and wear ourselves out in 20 minutes of very, very intense exercise, we think we might be too tired to study or to perform well cognitively afterwards. Actually, what we found is the exact opposite. So this picture is showing hemodynamics in the brain. It's looking at blood oxygenation in different parts of the brain before and after exercise. And what we found is that performance on the cognitive test actually improves after exercise, even if it's really intense exercise. So the next time you're studying for your A levels, make sure you go for a run beforehand, because you'll remember a lot more for your exams. And last but not least, we did get to test a couple of 70 and 80-year-old participants. And what we found is that exercise protects against cognitive decline, especially in old age. So these amazingly fit elderly participants had very, very high cognitive scores. And that's purely because they just kept exercising throughout their lives. And here they are. These are our students finally ready to take their degrees once they proudly submit their research that they've done alongside the team.
So just to finish then, in the program that we're offering, we're giving you an opportunity to merge passion with profession. So especially those with an interest in physical activity, being active. You may not necessarily be the best sports people. We're not looking for that, but that sort of enthusiasm and passion for being physically active and wanting to work with to get people active, and also those that are already active, that will come across in your interactions with not just us, but also with your clients and patients in the future. So that passion will take you a long way, and this is a program that will be well suited for those types of people in particular. So if you have any further questions, do feel free to contact us. Our email addresses are here. Our teaching administrator, Atlanta, is also available for general queries about admissions and queries about UCL and so on. And she may also be able to forward this on to other relevant people at UCL and in our teams as well if she can't answer it herself. But we look forward